As we age, our risk for macular degeneration increases. Though there is no cure, there are treatments to stabilize the disease. For those being treated for macular degeneration who still aren't pleased with their vision, there is hope. The low vision specialists of Maryland and Virginia are just what the doctor ordered.
Low vision is basically poor vision, reduced vision, that normal regular glasses, contact lenses, or surgery can't help them.
Around 5 years ago, my vision was declining because of my macular degeneration, and I was having particular problems with driving and reading.
See, make yourself comfortable.
They had said to me, you really shouldn't drive. Well, that's a death sentence for somebody who's very independent.
But reading and driving.
Reading, driving. And my retinologist suggested to me that I really should see a low vision specialist.
And you'll be able to see things far away. Majority of patients are usually elderly patients because the diseases were created by getting older, unfortunately. So macular degeneration is usually the number one cause of loss of vision in the over 65 age group. A regular eye examination, usually look in the back of the eye, look at instruments, microscopes to determine glaucoma, cataracts, macular degeneration, and then a prescription analysis. A low vision examination goes beyond that, where we take the time to find out their patient's goals and needs, to find out their exact precise prescription, and then we show them very unusual lenses called microscopes and telescopes. So microscopes are for reading, telescopes are for distance, driving, TV, or computers.
He determined that I did in fact need the telescopic glasses for distance and driving.
We actually take a telescope and compact that into a pair of glasses, and now the patient is able to drive, watch TV, use computers. Or we'll take a microscope and compact that into a pair of glasses, and now the patient can do their reading, read their Bible, read their magazines, and involve themselves back into what they used to do. These lenses are customized to the individual patient, and a lot of optics and physics and creativity is determined the proper lenses for the patient. So after the examination, there is a lot of time involved in designing the optics for that patient and being creative to help the proper optics for that individual. So every individual is different needs and different goals. So the final product is customized for their patient.
He really is, as far as I'm concerned, pretty much a miracle worker. I'm sure many, many people, he's made their lives 1,000% better.
These patients can be helped and can see better, and they could have been seeing for the last 5 or 10 years when they've been told nothing can be done. If you have macular degeneration, there is hope, there are options out there, and you can be helped. It was a real pleasure.
Because it's often difficult for low vision patients to get around, Dr. Avastin sees patients at their eye doctor's office, and he also makes house calls. For him, work is a family affair. He's been in practice with his brother for 36 years, and his youngest son will join them in 2 years, which will allow Dr. Avastin to treat low vision patients 6 days a week.